Hello everyone, my name is Gopal Kumar and I am pursuing Masters in Physical Education from LNIP Gwalior. And today we will have a presentation on cardiovascular diseases which is being supervised by Dr. Brij Kishore Prasad, who is an assistant professor in LNIP Gwalior. So in this particular presentation we will discuss on the following topics, starting with the introduction about cardiovascular diseases. There are some common types, facts and statistics around the globe, some causes and risk factors, and in the last we will discuss about the effect of exercise on cardiovascular diseases. Okay, so talking about the introduction about the cardiovascular diseases, the cardiovascular disease contains two words. The first one is cardiovascular and disease. Cardiovascular refers to cardiovascular system. Cardio means heart and vascular means blood vessels, and disease refers to any sort of disorder in the structure or function of any of the body part. So the meaning of cardiovascular disease becomes, cardiovascular diseases are a class of disease that involves heart and blood vessels. When there is any problem in the heart itself or any of the vessels throughout the body, that becomes cardiovascular diseases. One more definition: heart conditions that include diseased vessels, structural problems and blood clots. So there are various types of cardiovascular diseases, and we will be discussing about some of the major types of cardiovascular disease. In this, the first one is coronary artery disease. Coronary artery refers to the arteries of the heart itself. So when there is any damage or disease in the heart's major blood vessels, that becomes coronary artery disease. As you can see in this diagram, this is the normal artery of the heart, and in this particular artery the plaque has been accumulated. When the plaque accumulates in the walls of the artery, that becomes atherosclerotic artery, and when there is plaque accumulated in the walls of the artery, in any artery, there is reduced blood flow. Okay, so the next one is cardiac arrest. Cardiac arrest refers to sudden or unexpected loss of heart functions because of the malfunction in the conduction system of the heart. So the conduction system of heart works like, it starts with the SA node, which is the pacemaker of the heart, then to the AV node, and then through Purkinje fibers it spreads to the whole heart. So when there is any problem in this process of conduction, that becomes cardiac arrest. Okay, there are two similar terms. One is cardiac arrest, second one is heart attack, and many of the people think that these two terms are synonym of each other, but it is not. See, cardiac arrest is an electrical problem and heart attack is a circulation problem. When there is any sort of problem in the conduction system of the heart, that becomes cardiac arrest, but when there is problem in the circulation of the blood to the heart itself, that becomes heart attack. Okay, next is congestive heart failure. Congestive refers to crowded, very crowded. So it is a chronic condition in which the heart doesn't pump blood properly. So in this diagram you can see that this is the normal left ventricle of the heart, and in this particular diagram the walls of the left ventricle get thickened, because of which the heart is not able to pump blood properly. Next one is arrhythmia. Arrhythmia refers to improper beating of the heart, and that improper beating can be irregular, can be too fast or can be too slow. We have two terms here, one is tachycardia and another one is bradycardia. So what does tachycardia means? When the resting heart rate of a person becomes too high, above 100 beats per minute, that condition is known as tachycardia. And the next one is bradycardia. When the resting heart rate of a person becomes less than 60 beats per minute, that becomes bradycardia. Okay, bradycardia can be a result of chronic endurance training or chronic any sort of sports training. But when that similar condition happens without any sort of adaptation, that becomes arrhythmia. Okay, so in this diagram this is the case of too fast heartbeat, that is tachycardia. In this diagram the heart rate is very slow, that becomes bradycardia. Okay, next one is peripheral artery disease. So we talked about coronary artery disease, in which there is problem in the arteries of the heart itself, and when we talk about peripheral artery disease, there is reduced blood flow in the limbs of the limbs of the body parts. So in this particular diagram you can see that this is the artery supplying blood to the lower limbs, and the same thing happens, that is the plaque get accumulated inside the walls of the artery, and that reduces the blood flow to the lower limbs. Okay, next one is stroke. Stroke is any sort of damage to the brain itself, and this problem is similar. That is, this is the normal carotid artery which supplies blood to the heart, and when the plaque accumulated inside the carotid artery, that becomes atherosclerotic artery, and again there is reduced blood flow inside the brain. So when the blood is not being supplied to the brain, then any sort of damage can happen to the brain, okay, and we call this stroke. The next one is hypertension. Hypertension refers to a condition in which force against the walls is too much high, okay. So the normal systolic and diastolic blood pressure, as we say, is 120 and 80. When the force against the walls becomes too high, the blood pressure, that is systolic and diastolic, increases, and when it increases beyond 140, that systolic blood pressure increases above 140 values and diastolic becomes above 90 values, the condition of hypertension occurs, okay. Next one is congenital heart disease. Congenital word refers to anything which is present since birth. So similarly, in congenital heart disease, an abnormality in the heart that is present since birth, okay. So you can see in this diagram, this is the normal heart, especially focus on the area of the left ventricle, okay. We have septum present over here, but in this particular diagram, when the person is suffering, or when the heart is suffering from ventricular septal defect, the septum is absent. So when the left ventricle will pump blood to the various parts of the body, some of the blood gets pumped into the right ventricle. The reason is ventricular septal defect is a very common defect. You might have heard, we call this by other name called hole in the heart, dil mein chhed hona. Okay, when a person is suffering from ventricular septal defect or hole in the heart, he is advised not to go for vigorous type of activities, because when a person is involved in vigorous type of activities, the blood demand increases and the left ventricle has to pump blood more forcefully. So when the left ventricle so does, some of the blood get pumped into the right ventricle, okay. So this was all about some of the major types of cardiovascular diseases. So why are we talking so much about all these cardiovascular diseases? The reason are, we will have a look about some facts and statistics around the globe. So according to American Heart Association, cardiovascular diseases are the leading cause of death in United States. In the year 2006, 81.1 million Americans had one or more of the types of cardiovascular diseases, and that resulted in around 8,31,000 deaths, okay. One more, according to Memorial Heart and Vascular Services, every 3 seconds someone dies from heart disease or stroke. One more report is from the World Heart Federation, according to which the number one cause of death worldwide are the cardiovascular diseases, okay. And not talking about the world, in India itself, it is the report of Registrar General of India 2009, cardiovascular diseases are the leading cause of death in the case of both men and women, okay. So there are various causes and risk factors of cardiovascular diseases, and all these causes and risk factors can be divided into two categories. The first category is non-modifiable risk factors, and the other one is modifiable risk factors. So all those non-modifiable risk factors, a person can not do anything about those things, such as heredity, race, sex, advanced age. If a person is suffering from all these things, he has these things, he can't do anything about all these things. But the things that can be altered by by modifying his lifestyle, we call them primary risk factors or modifiable risk factors, and we will be talking more about primary risk factors. So the primary risk factors include all these things: having constantly high blood pressure, total cholesterol level, tobacco smoking, obesity or overweight, diabetes, and physical inactivity. One thing we should note over here, that almost all these things are related to each other. When a person is physically inactive, he will obviously gain weight and will have a high total blood cholesterol level that will lead to diabetes, okay. So one thing that you should focus over here is that all these things depends on energy balance, and energy balance means the amount of calories you intake and the amount of calories you expend. So whatever you are eating and whatever sort of workout you are doing, so there should be balance between these two, okay. Amount of calories you intake, that should be expended when you go for any sort of physical activity. So when you will burn those calories, there will be no calories inside your body remain, and that will obviously help you in maintaining your weight. So one thing which is very important about cardiovascular diseases is that cardiovascular diseases are entirely preventable. That means if you are taking care of all these primary risk factors, you can reduce the occurrence of cardiovascular diseases. Okay, so to reduce the occurrence of cardiovascular disease, you just have to involve yourself in any sort of physical activity, or you need to maintain your blood pressure as well as your cholesterol level. You should quit smoking, and when you will involve in any sort of physical activity, regular physical activity, you will maintain your body weight, and that will help you in monitoring your diabetes or overweight. Okay, next thing is exercise in cardiovascular disease. How exercise can help in preventing or reducing the risk of cardiovascular disease. There are many sort of epidemiological evidences, which means a lot of research has been done in this particular area, which says that when a person is physically active, there are minimal chances that he will gain any sort of cardiovascular disease in his future, because there are many types of physiological adaptations with training that helps to reduce risk. That means when a person is involved in regular physical activity, many adaptations takes place in his body in the terms of cardiovascular system, respiratory system. So when a person is involved in physical activities, he will not gain weight. Okay, the efficiency of his heart becomes very good. So with the help of these adaptations, there is reduced risk of cardiovascular diseases. Also, there is risk factor reduction with exercise training. So you might have seen many of the persons who are involved in regular physical activities, they become very conscious about their health, and they suppose I am going to gym or I am going for workout daily, so I will not be involving in any of those bad habits that will lead to cardiovascular disease, such as I'll quit smoking, I'll not be consuming bad food, that is fast foods or any sort of other food, I will be maintaining my weight. So there are researches that proves that there is risk factor reduction with exercise training. So in this particular session, we have discussed about the introduction about the cardiovascular diseases, some of the major cardiovascular diseases, and why are we focusing so much on these cardiovascular diseases. And in the last, we have discussed about the causes and risk factors, how can you minimize them. Okay, these are the references that I have gone through. Okay, so if you like this video, please share this video. Thank you very much.